In many situations in life, we are seeing more and more people wanting to be active participants in their health and well-being, especially when it comes to dental care. This means clinicians everywhere are having to learn new ways of engaging patients. We're moving away from a clinician-centered approach, where we might be thinking, we're the experts, you should listen to us, to a patient-centered approach that engages patients in a way that meets them where they are in terms of their wants and needs. This involves a redefinition of the patient-centered relationship. Patients are no longer passive recipients, but rather active participants who work as partners with dental health care providers to optimize oral health. The opportunities that come with such a collaborative and patient-centered care model means the clinician must learn how to approach the patient differently, which can be difficult, especially for someone like myself who had been practicing for 18 years before I learned about the patient-centered approach, having been accustomed to advising patients from the perspective of, I'm the expert, I tell you the task that will help mitigate or control oral disease, and then you go home and you do them. Now I have to stifle my desire to tell them all the ways they need to be managing their health better. And now I ask them, what do you want to do? Tell me about your lifestyle so I can use my expertise to give you options that will work for you. I think we can all agree that active involvement from the patient is necessary to guarantee effective self-management for one's oral disease. Allowing for personalized recommendations where the patient has the autonomy to say, yeah, I can do that, or no, that won't work. That's incredibly empowering. A combination of giving the patient options that are personalized while asking open-ended questions has changed so much about how I interact with my patients. These patient-centered techniques have even helped me understand the root cause for the why behind patients' refusal of specific treatments. Instead of telling them why a procedure is needed, I ask them open-ended questions. And then I listen for clues that will help me better understand where they're coming from and why they are resisting. I'll be the first to admit that this isn't always easy. Maybe I'm running late. Maybe I'm tired. Or my need to be the expert comes out. And I want to tell the patient that these are the recommendations. Period. The end. But there are 3 tips that I can share with you that have personally helped me experience a more collaborative, patient-centered relationship, which in turn can help you too. Tip number 1, slow down. Engage the patient in the discussion, even if you're running behind. Allow them to practice their autonomy and have an open dialogue where you genuinely listen to them. This can help you learn more about why they are ambivalent towards your recommendations of their oral health, and can start the process of moving the patient from resistance and into acceptance. Tip number 2, help the patient stack their new habit with an already established pattern. I do this by asking the patient if they already have daily routines and if they can see themselves including at least one new oral health habit into their established daily practices. Let the patient come up with a time and a place to get started. This will help them continue to move away from ambivalence or even resistance and into acceptance, allowing them to be the one to find the time to practice the oral health suggestions. Tip number 3, give yourself and your patients some grace as you learn these patient-centered techniques. It takes time and it takes practice, and you will not get it right with every patient. But the more you engage and rethink your approach, the easier the techniques will be. I don't always get it right. After a day in the clinic, I look back on some of my interactions and I think, oh, I could have asked that question differently. Or I was offering too many solutions instead of letting the patient come up with some on their own. But I learn from it. And I catch myself the next time I want to tell the patient what and when they should be performing their new habits. As we see people become active participants in their lives, clinicians everywhere will have to learn new ways to engage patients, moving away from the clinician-centered approach. We now need to allow our patients to exercise their autonomy while actively participating in their oral health self-management. I encourage you to investigate the patient-centered model, particularly looking at motivational interviewing techniques, so you can help your patients create healthy habits so they can live their best lives. To learn more about preventive solutions, visit henryschein.com.